Transcatheter valve replacement, TAVR or TAVI, is a minimally invasive procedure used to replace a diseased heart valve without requiring open heart surgery. It is commonly used to treat conditions such as aortic valve stenosis, where the aortic valve becomes narrowed, leading to restricted blood flow from the heart to the rest of the body. Key features of TAVR: minimally invasive approach. The procedure is performed using a catheter inserted through a small incision, often in the femoral artery in the groin, or another vascular access point. Replacement valve, a specially designed artificial valve, often made of biological tissue, bovine or porcine, is delivered to the heart via the catheter. Once in place, the new valve is expanded, usually with a balloon or by self-expansion, pushing aside the old valve and taking over its function. Advantages: shorter recovery time compared to open heart surgery, reduced risk of complications for high-risk or inoperable patients, no need for large chest incisions or cardiopulmonary bypass. Indications: primarily for patients with severe aortic stenosis, often reserved for those at intermediate to high surgical risk due to age, comorbidities, or other factors, increasingly used in lower-risk patients as evidence supports its effectiveness. Procedure steps: preoperative imaging and planning, CT scan, echocardiography to assess anatomy, insertion of the catheter under fluoroscopic and echocardiographic guidance, deployment and positioning of the replacement valve, evaluation of valve function and removal of the catheter. Risks and considerations: potential complications include bleeding, vascular injury, stroke, arrhythmias, or valve leakage. Regular follow-up is required to monitor the function of the replacement valve. TAVR has revolutionized the treatment of valve disease, especially for patients who are not candidates for traditional surgical valve replacement. It's a highly effective option with excellent outcomes in appropriately selected patients.